Hey there, Kim Law here again. Today, we are digging into the world of lymphoma, uncovering the truth and dispelling myths that have been clouding our understanding. Think of this myth as like tangled webs that need to be untangled. Let's clear the path to enlightenment as we debunk 5 common lymphoma myths with simplicities and clarities. Myth number 1. Lymphoma is real and doesn't affect many people. Ever thought that lymphoma, a type of cancer, is super rare and hardly affects anyone? Well, that's not true at all. It's a bit like believing that finding a 4-leaf clover is not easy. In fact, in United States alone, a type of lymphoma called non-Hodgkin lymphoma is quite common. It's responsible for about 4% of all cancers. And guess what? In 2023, approximately 80,550 people, both adult and children, will be diagnosed with non-Hodgkin's lymphoma, NHL. So, it's more likely you can spot 4-leaf clovers everywhere. Let's learn more. Lymphoma isn't real. Lymphoma is not some super rare thing. It happens more often than you might think. Non-Hodgkin lymphoma, NHL, in particular, is one of the cancers that quite a few people get. Different types. Lymphomas actually has different types, with some being more common than others. Non-Hodgkin's lymphoma is one of the most common ones, but there's also Hodgkin's lymphoma, which is less common. Treatable. The good news is that many people with lymphoma can be treated successfully, especially when it's caught early. Treatment might include chemotherapies, radiations, or even a bone marrow transplant. Awareness matters. Knowing about lymphoma and its signs is important. Things like swollen lymph node, unexplained weight loss, and fatigue can be signs to watch out for. If you notice any of these, it's essential to talk to a healthcare provider. In summary, don't fall for the myth that lymphoma is super rare. It's more common than you might imagine, but the good news is that there are treatments available. Staying aware of the signs and seeking medical advice when needed can make a big difference in catching and managing lymphoma early. Myth number 2. Only older people get lymphoma. Did you ever think that lymphoma, a kind of cancer, only affects older folks? Well, that's not quite true. It's a bit like assuming roller coasters are just for those who love big thrills. In fact, lymphoma can strike at any age. It's more like believing playgrounds are only meant for kids, but that's not the whole story. Lymphoma is one of the cancers that's not just about older adults. It can happen to children, teenagers, and young adults too. But here's the interesting part. As we get older, our chances of getting lymphoma do go up. Why young people get lymphoma? Lymphomas can affect young people because it isn't tied to age alone. There are different types of lymphoma, and some are more likely to happen in specific age group. For instance, Hodgkin lymphoma is more common in young adults, while non-Hodgkin's lymphoma can affect people of all ages. In a nutshell, don't buy into the myth that only older folks get lymphoma. It's a cancer that can show up at any age, from the kids to the grown-up. And good news is that there are treatments available no matter your age. Staying on the lookout for signs and seeking medical advice when needed can make a real difference in catching and treating lymphoma. Myth number 3. Lymphoma is a death sentence. Have you ever thought that if you have lymphoma, it means that end of the road? Well, that's not true at all. It's a bit like believing that every path leads to a dead end. The reality is quite different. Yes, lymphoma is a challenge, but it doesn't mean you are doomed. There are some good news. Treatments for lymphoma have gotten a lot better, and researchers have made progress. In fact, between 2011 and 2020, the number of people dying from lymphoma decreased by 2% each year. It's a kind like discovering new routes on the journey of life. Why lymphoma isn't deadly? Improved treatments. Doctors now have more effective treatments for lymphoma. These treatments include chemotherapies, radiation therapies, targeted therapies, and stem cells transplant that can help a lot in managing the disease. Research advancements. Ongoing research into lymphoma has led to better understanding and new treatment options. Scientists are always looking for ways to improve outcomes and quality of life for lymphoma patients. Early detection matters. Catching lymphomas early is crucial. Regular checkups and pay attention to symptoms like swollen lymph nodes, unexplained weight loss, and fatigue can lead to earlier diagnosis and better outcomes. Supportive care. Alongside treatments, there are supportive care options to help manage side effects and improve the overall well-being of lymphoma patients. In summary, having lymphomas doesn't mean it's the end of the road. There are treatments that work, research is making strides, and survival rates are improving. It's like discovering new paths in the journeys of life, even when faced with the challenge like lymphoma. Early detections and staying informed about your health are key steps in facing this condition with hope and resilience. Myth number 4. Only men are at risk of lymphoma. Have you ever thought that lymphoma, a kind of cancer, only targets men and not women? Well, that's not true. It's a bit like believing that a tasty recipe can only have one ingredient. But in reality, lymphoma doesn't pick sides based on gender. Both men and women can be at the risk getting lymphoma. For example, the chance that a man might get non-Hodgkin lymphoma in his lifetime is about 1 in 43, and for a woman, it's about 1 in 53. So, it's not a one-person show, it's a shared risk. Why lymphoma isn't only for men? No gender preference. Lymphoma doesn't favor men over women or vice versa. It can happen to anyone, no matter their gender. Different kinds. There are various types of lymphoma, and while some types might be a bit more common in one gender, it doesn't mean they are exclusively affect men or women. Risk factors. Certain factors like genetics, exposure to certain viruses, or environmental factors can contribute to lymphoma. These factors don't care whether you are a man or a woman. Being aware is important. It is crucial for everyone to know the signs of lymphoma, like swollen lymph nodes, unexplained weight loss or fatigue, and to see a doctor if they notice these signs. In a nutshell, don't fall for the myth that only men can get lymphoma. Both men and women can be at the risk. It is important for everyone, no matter their gender, to be aware of their health and take action if they notice any signs of lymphoma. Myth number 5. There is nothing we can do to lower the risk of lymphoma. Have you ever thought that preventing lymphoma, a type of cancer, is like trying to dodge a storm? Well, that's not entirely true. Some of our lifestyle choices can actually affect our risk of getting lymphoma. It's more like guiding a ship through rough waters. Simple steps, like staying healthy and going for regular checkups, might not guarantee we avoid every storm, but we can definitely help make the journey smoother. Plus, here's some good news. The number of people getting non-Hodgkin's lymphoma, NHL, has been decreasing by about 2% every year since 2011. Why we can influence lymphoma's risk? Lifestyle choices matter. Some things we do in our daily life can impact our risk of lymphoma. For example, not smoking, eating a healthy diet, and staying physically active can lower the risk. Regular checkups. Going for regular checkups and keeping an eye on our health can help detect any problems early. Early detection can be a game changer. Awareness helps. Knowing the signs of lymphoma like swollen lymph nodes, unexplained weight loss, or unusual fatigue, and getting medical help if we notice them is essential. Research continues. Scientists are always studying lymphoma to find better ways to prevent it and treat it. So, there's hope for even more progress in the future. In summary, don't believe the myth that we can't do anything to lower the risk of lymphoma. Just like guiding a ship through choppy waters, we can take steps to make our journey healthier. Simple things like healthy lifestyle and regular checkups can help smooth out the path. And remember, the number of people getting non-Hodgkin's lymphoma has been on a downward trend, which is a positive sign. So, it's not like avoiding an unchangeable storm. It's more like having some control over our journey. Lymphoma is a type of cancer that affects the lymphatic system, which is a crucial part of your immune system. It's responsible for fighting off infections and disease. Lymphoma originate in lymphocytes, which are a type of white blood cells that helps the body fight infections. Cause of lymphoma. The exact cause of lymphoma is not always clear, but there are some known risk factors. Age. Lymphoma can occur at any age, but is more common in older adults. Gender. It affects both men and women, though some subtypes may be more common in one gender. Family history. If a close family member has had lymphoma, your risk may be slightly higher. Infections. Certain infections, such as the Epstein-Barr virus, EBV, or HIV, can increase the risk of lymphoma. Common symptoms of lymphoma. The symptoms of lymphoma can be various depending on the type and stage of the disease, but common signs include swollen lymph nodes. These are often painless lumps that you can feel in your neck, armpit, or groin. Unexplained weight loss. Losing weight without trying to can be a symptom of lymphoma. Fatigue. Feeling very tired or weak even you have had enough sleep. Night sweats. Experiencing excessive sweating, especially at night, that drains your clothes and bedding. Fever. Having a persistent, unexplained fever that doesn't go away. Itchy skin. Some people with lymphoma may develop itchy skin or a rash. Pain. In some cases, lymphoma can cause pain, which can occur in the abdomen or even in the chest if it involves lymph nodes in that area. It is important to note that these symptoms can also be caused by other medical conditions. So, having these symptoms doesn't necessarily mean you have lymphoma. However, if you experience persistent symptoms or are concerned about your health, it's essential to consult a healthcare provider for a proper evaluation and diagnosis. Early detection and treatment can significantly improve the outlook for individuals with lymphoma. Thank you for joining Kim Law today. Before you move on, be the guardian of truth. Hit the share button to cast a light on this debunked myth. Give us a thumbs up if this journey resonates with you. And don't forget to subscribe for more myth-busting exploration. Let's dispel the thoughts of misconception, embrace the light of knowledge, and move forward, hand in hand with awareness. Until next time, keep seeking the truth and keep shining bright.